begin treatment immediately.
You'll need to follow up in the clinic in 5 days.
Where should I go?
You have a 1:30 at Clinic C.
Take the elevators to B1 and follow down
We'll
the
schedule
hall.
the surgery.
Will I see my kids grow up?
Rhabdomyosarcoma is a
This type of cancer is
I have
high.
5
Following the
appointments
transplant,
today.
the anti-rejection drugs.
I never thought this would happen to me.
When you go through something like a cancer or any kind of medical diagnosis that's all brand new to you, being a patient is not easy.
They come to us scared. They come to us frightened. They look at this huge monolith that we have, this hospital complex, and they say, wow, what am I coming to now?
As a staff member here at the University of Michigan Health System, we each have a job to do, and we take our jobs very seriously. But it's often easy to forget that what's a normal day for us is hardly a normal day for the patients we serve. Each one of us, regardless of our job title or position, makes a difference every day in the lives of our patients and families. Creating the ideal care experience for each and every patient must be the goal of every member of our team.
Taking care of patients is a privilege because patients let you into their lives at the most vulnerable of times. And if we respect that deeply and understand that it's a privilege that we're being allowed, the experience is enriched for both the patient and the provider.
We all know the golden rule is to treat others like you want to be treated. Patient and family-centered care at the University of Michigan is about the platinum rule, taking the extra time to find out how each person, each family wants to be treated and going the extra mile to bring them their ideal care experience. An integral part of creating service excellence is rooted in how we interact and communicate with those we serve and with each other.
Each year, about 1.7 million patient encounters occur at the hospitals and clinics of the University of Michigan Health System. But no two patients are alike, no two families are alike, and no two stories are alike. That's why all of us need to be mindful of the unique needs of each patient and family.
And I got 2 soda.
Oh, yeah.
When you're looking at patients that have cultural differences, it's not something that they're doing to burden you. It is basically they're bringing their whole selves to the hospital, and there's not a way for them to leave that portion of them at the door. And our job is to try to incorporate their cultural diversity into the care that we deliver.
Here at the University of Michigan, we have extensive supports available to assist patients and families who may not speak English or have special needs. Contact the Office of Interpreter Services for translation needs or for assistance communicating with those who are deaf or hearing impaired. Language and cultural competency training is also available to UMHS staff. Refer patients and families to the University of Michigan Guest Assistance Program to connect them with support services and resources to meet additional needs. When serving patients and families from different cultures and backgrounds, it's critical to ask questions. What should health providers and caregivers know about their unique needs? Are there special religious considerations or dietary restrictions to be aware of?
It is very important for staff to remember the platinum rule and to learn how it is that families want to be treated based upon their spiritual and cultural backgrounds, and to meet them where they are and to provide the care based upon these factors that make them unique human beings.
This may mean that some patients will have special needs that have to be addressed, such as in my area in the breast center, there may be women from a particular culture who, for religious or cultural reasons, may require that their healthcare providers be only female. We have to respect those types of needs and honor them.
Respect everyone's privacy and dignity. Knock before entering a patient's hospital or clinic room. Allow the individual to maintain modesty. Introduce all team members, and describe to the patient and family why you're there. If medical students are part of the care team, ask permission to have them in a room.
It's very important to be mindful of every patient's needs, because if we don't do that, then it creates barriers to their care.
Don't make assumptions about those who visit our health system based on dress, gender, age, or family. And remember, while showing empathy is a critical part of the care we deliver, your personal religious beliefs should stay just that, personal.
Should a staff member say, "I'll pray for you"? Probably not. There are many things that staff can do to let a family know that they're caring, like a touch on the shoulder, a hug in some situations, a smile, simply, "I'm sorry."
We have difficult jobs. As a team, we care for people who are ill, families in distress. There are many demands on our time, and our lives can be high stress. Remember that even on our toughest day at work, our emotional challenges and personal biases need to be left at the door. We are here to serve patients and families.
My family is extremely close. We are Spanish, Cuban actually. Our family takes care of our own. My dad had been taken to the emergency room, and the doctor came out and told me he believed that my dad may not survive this hospitalization. When he told us that, we were like in shock, because this was a person who was walking, talking, shopping, doing all his normal stuff until he had that syncopal episode and ended up in the ER.
As Carmen's father grew more ill, family members flew in from across the country. His large family wanted to be by his side and involved in his personal needs. But in order to care for him, staff felt the need to limit the number of visitors.
Family members, regardless of the ethnicity and the cultural differences, they want to be involved. So that is very critical, and actually it's quite important for the staff to recognize that and be welcoming. When there's a lot of family members, just sit down and explain that it's very important to pick someone to be the spokesperson, and it is important that communication with the staff cannot occur at every moment, but pick several points throughout the day that you can communicate about the patient's care.
I think when you're caring for a patient, you need to care for the family. And just like you ask the patient, is there anything you need? Is there anything that you have questions about? You should give that same courtesy and respect to the family.
I actually think that we're pretty much all the same, except we have different languages, we may look different skin color, etc. But underneath all of that, we all want to have nurturing people taking care of us, be nice to us, be polite, and do their best.